Welcome to this episode of Family Practice. I'm Dr. Jeff Fox. Tonight we're going to talk about carpal tunnel and some new surgical trials that you might be interested in. We're also going to look at telehealth, a new technology that makes the exam better. We're also going to remind you why it's still important to take care of your cholesterol. All that and the nest is here. But to start off with, my first guest is Dr. Victor Marwin, who is an orthopedic surgeon with Bluegrass Orthopedics, and you have specialty in upper extremities.
Yes.
Now, I mentioned carpal tunnel, and you're doing some new trials. We're going to talk about those in a minute, but kind of update us and explain carpal tunnel before we get to the surgical part of it.
Sure. Simply, carpal tunnel is compression of one of the nerves in your wrist, the median nerve, as it goes into your hand, and that's what causes the characteristic numbness, tingling, and sometimes pain to the thumb, index, middle finger, and part of the ring finger. It can affect people more at night. It can affect dexterity and ability to handle and feel things, and kind of get in the way of daily activities.
Are there any people that are more prone to having carpal tunnel?
Typically, as you age, you're more prone to it. Diabetes and obesity can affect it. Women are more likely to get it than men.
Now, we're going to talk a little bit about surgical. Before we even get to surgical, there are other things you can do other than surgery.
Yeah, absolutely. There are some good non-operative treatments, such as night splinting and sometimes an injection. I always stress to patients they should try non-surgical options, but the important thing is to not wait on on seeking treatment for the diagnosis. Unlike a worn-out joint, where we try and have patients deal with it as long as possible before a joint replacement, we're not replacing a nerve. This is nerve tissue. It's very delicate. There are some changes that can happen to the nerve. Some of them can be irreversible, including muscle loss, and we want to catch it before it gets to that point. So a lot of times people come to me, they've been suffering with this for a long time, and it's kind of frustrating because if we caught them maybe a little bit earlier, they may have a little bit more symptom relief, and they may be a little bit happier before it gets too bad that some of those irreversible changes can happen.
Well, now, so if you're going to operate on us, tell us a little about the surgical technique and the trials that you've done and are getting ready to do.
Yeah, there's a lot of ways to do the surgery. And essentially, if you break it into two categories, there's the traditional open approach, which is tried and true and a great surgery. It does scare some people off because you have to cut through all the layers of the hand to get down to the nerve. It can be a protracted recovery. Some people can take up to 6 weeks to get back to activities. More minimally invasive techniques exist. They've existed for over 20 years. One of the techniques that I do, the one that I pretty much do exclusively because patients do so well, is utilizing ultrasound guidance to visualize the structures in the hand and the wrist. In surgery, exposure is everything, and if you can't really see what you need to see, things become risky, and it's harder to kind of do what you want. In my opinion, using ultrasound guidance allows excellent exposure, essentially unlimited exposure, because the ultrasound allows me to see all the tissues in the hand and the wrist that are of interest to me. And I'm still using a very small incision, so I don't have to open you up to take a look at all those things. I can see with an ultrasound probe in real time. So it's the best combination of a minimally invasive surgery with maximum exposure and safety, in my opinion.
Now, you've got a new trial that's coming up, and people may want to participate. Tell us about that.
Sure. So we wrapped up the robust trial just recently, and that data, the 6-month data, has been published in the Journal of Hand Surgery this month. It's actually linked on my website at Bluegrass Ortho. If patients want to take a look at it, they're welcome to. We found that patients in the study had the same great results that we were seeing anecdotally in the clinic. Patients were returning to work very quickly, very happy, and it was a multi-center study. I was one of the investigators, and the study showed that our average return to work was 4 days, average return to activities was about 2 days, and a 94% satisfaction rate amongst our patients. So really, really great outcomes.
Now, how long are you going to be enrolling patients in the study?
Yeah, that study wrapped up. The new Mission study, which is a clinical registry. Again, this is not new experimental surgery. This is tracking patient outcomes over a 2-year period. We're starting to enroll in that now, so immediately. And ongoing enrollment will take place for about a year or so until we fill up all slots. I'm the principal investigator for the study. It's being run out of Bluegrass Ortho. So we have a lot of slots for patients to participate if they want to, help with this great study that helps us really track patient outcomes.
And the patient outcome you just said, I would like you to reiterate here.
Sure.
It's all about short healing time, back to work, not any morbidity.
It's about getting the job done and relieving their symptoms without having to cut unnecessary tissue, without having to expose unnecessary things. And by doing that, patients return quickly, they have less pain, they have better function, and those are a lot of the things that scare people away from surgery and make them kind of put it off, and then they suffer unnecessarily. There's just a better way to do this, and we're really interested at tracking this data.
It's great. We appreciate you coming in, and thank you for all you do.
Oh, I'm happy to. Thank you.
And if you have carpal tunnel or carpal tunnel symptoms and may want to participate in the study, contact Bluegrass Orthopedics. We'll be right back.